Okay, so I did my presentation on evidence-based practice for bedside reporting. What I did is I took 5 scholarly articles and used our policy for bedside reporting. And basically what it all involved was that patients want to be involved in their care. Bedside reporting, if you define it, transfers the care of a patient to another RN, including legal accountability and responsibility. What this is important for is the evidence-based practice. So this is studies and put into practice by staff RNs. But an issue is non-compliance with RNs to doing bedside reporting. My question was, how can bedside reporting involving patients in contrast to reports given without visualization of the patient or input from the patient affect both patients and RNs? So that's what all the studies were kind of over, was feedback from that. So my objective was to provide education to our staff here at Baptist in Arkadelphia and improve overall compliance of med-surg RNs here to doing bedside reporting. The results from most of these studies was that miscommunications can lead to almost 80% of all medication errors. So, and they're all attributed to ineffective communication. Studies here suggest that standardized bedside reporting or a standardized handoff with checklists or forms can increase patient satisfaction and safety.
Sure.
So I included in this presentation 2 forms that I already use here. One is of a report sheet that I made for when I give reports, and the other is an admission form when I've received reports from the ER. And I've been using this for a couple of months now here on the floor.
Is it working for you? Good.
I have them available to the other nurses, and some of them are using them too.
I've seen this form before. Other nurses are using it.
Yeah. So it seems to be working pretty well.
Good.
Another standardized bedside report is SBAR. We have that available on Epic to go over and read off of. One benefit it said for bedside reporting was that it keeps reports focused on the patient. Because when you're in front of a patient, you're not going to talk about your hair appointment or...
No, you're not.
It's all on the patient.
Yeah.
Another one is going in and actually seeing the patient gives you a chance to do a mini assessment. You can look at IV rates or oxygen strains, their pain levels, their mobility, their cognition. You can check that when you're in the room.
Sure.
Yeah.
Good job.
So that was a benefit. A simple graph that I added to the presentation was benefits. Benefits included increased patient safety, satisfaction of patients and their family, as well as RN job satisfaction. One of the studies included that once implicated, bedside reporting leads to decreased overtime for nurses. And another benefit was patient inclusion for their plan of care. Decreased adverse events such as falls or med errors, instances of overtime, like I said. Decreased length of patient stay and hospital costs were also listed in some of the studies.
Sweet.
Challenges to actually doing bedside report was reluctance to wake the patient or to discuss sensitive, undisclosed information to them, and privacy concerns with semi-private rooms and visitors present.
Yeah.
And then RN participation and the non-compliance with doing bedside reporting.
That's our issue.
Yeah. In conclusion, these studies identified the need for further education for the RNs on the floor, increased leadership support, monitoring of the bedside report process to sustain the practice. The 3 outcomes, in conclusion, for this whole presentation was that increased patient and RN satisfaction, time management, and cost effectiveness, which I kind of highlighted. Satisfaction, time management, and cost effectiveness on the,
Yep.
yeah. And this research recommends that a committee of nurses run pilot trials, use standardized handoff forms, and that patients be involved in the
Good
process.
job.
That was basically it.
Good job.